Now, granulation tissues. Now, granulation tissues, you need to know that you have what is called good granulation tissues and you have what is called poor granulation tissues. Good granulation tissues and poor granulation tissues. Now, for good granulation tissues, we need to know that what their characteristics. The first P is that it is painless. Good granulation tissues are generally painless. Is it clear? They are not painful. The second one is that they are pulseless. Good granulation tissue are not having a pulse. Is it clear? That's another characteristic of a good granulation tissue. The third characteristic of good granulation tissue is that they have a pumpy head. Is it clear? Or it has a pin holding head. Sorry, a pin holding head. A pin holding head, meaning that what this is how the good granulation, the head of the good granulation tissue, it is just like a pin, as if they say the head of the pin. That's the head of good granulation tissues. Pin holding head. The fourth characteristic of good granulation tissue is that there's a pumpy hemorrhage. Is it clear? You have pumpy hemorrhage. Pumpy hemorrhage means that when you touch at the level of the granulation tissue, it bleeds. You touch at the level of the granulation tissue, it bleeds. That's pumpy hemorrhage. So those are the 4 P characteristics of good granulation tissue. And the next one is also that it is pink. Is it clear? So those are the 5 P characteristics of good granulation tissue. The first is pink. Good granulation tissue is that they are going to be very pink. The second thing is that they are painless. Generally, good granulation tissue are painless. The fourth is that they are pulseless. Is it clear? The fifth is that they have pin holding head. The head are like pins. Is it clear? The fifth is that we have pumpy hemorrhage. When you touch at the level of the granulation tissue, they bleed. So those are the 5 P characteristics of good granulation tissue. Now, the characteristic of poor granulation tissue is the contrary of the characteristic of good granulation tissue. Are you understanding? The characteristic of poor granulation tissue is the contrary of characteristic of good granulation tissue. So if you have any granulation tissue that is not pink, it is usually pale. Is it clear? It is pale. That is for a poor granulation tissue, or it a chronic, in the case of a chronic non-healing ulcer. Is it clear? They are usually going to be pale. They are going to be painful. Is it clear? When you touch it, is going to be generally painful, but it is painless when it is chronic. They are painful when you have an acute non-healing ulcer. Is it clear? But they are generally painless when you have a chronic non-healing ulcer. Is it clear? Now, they are pulseful. Generally, they have pulse because of excessive vascularization. There is excessive vascularization, but there is no proliferation because of unhealing ulcers. There is vascularization because we said that what in granulation tissue we have monocyte that is going to produce the angiogenesis factor. That is the blood vessels for growth factor. Is it clear? And that is going to result to excessive proliferation of the blood vessels, which is going to result to pulsefulness. So they are pulseful. Is it clear? And they are more pulseful than in the case of good granulation tissue because they are unhealing. Since they are unhealing, it's going to be excessive proliferation, angiogenesis, and since there's excessive angiogenesis, despite there is a poor healing despite to angiogenesis, there's going to be excessive proliferation again of the blood vessels. Now, the next thing is that they are not going to be having pumpkin hemorrhage. There is no pumpkin hemorrhage, and they are usually flat. They are not pin holding, they are flat and continuous. Flat and continuous. So those are the characteristics of non-healing ulcers. So when you have ulcers in front of you, it is either they are good or healing ulcers, or you have poor or unhealing ulcers. Is it clear? Now, to know if there are now other characteristics to know if an ulcer is acute or to know if an ulcer is chronic. Generally, an acute ulcer is one that occurs within the first 2 months. Is it clear? If you have an ulcer that occurs within the first 2 months of the patient, it is an acute ulcer. Why chronic ulcer occur after 2 months? Is it clear? And chronic ulcer, that's based on the duration. Is it clear? You have chronic ulcer, acute ulcer. Generally, you may have acute healing ulcers and you have acute unhealing ulcers. Is it clear? And you may have chronic healing ulcers and you have chronic unhealing ulcers. Is it clear? Each of them have a name. Is it clear? So those are the different characteristics of ulcers that you must put in mind. And now when you have those characteristics of wound healing, you must know also the management of a wound. Is it clear? It is very important to know the management of a wound. Is it clear? So now we are going to discuss on the management of a wound.